The topic that I chose to speak about in my research presentation was antimicrobial resistance. I'm Jessica Wright, and this is for Professor Maricle's Principles of Microbiology course at Barton County Community College. So before we get on with the rest of this slideshow, we first have to ask ourselves, what is antimicrobial resistance? According to the World Health Organization, antimicrobial resistance is what happens when bacteria, viruses, fungi, and parasites evolve and are no longer affected by the medications used to treat them. We are going to go over a few things in this slideshow. First, we are going to ask, why is antimicrobial resistance a problem? Next, we're going to explore how antimicrobial resistance happens. Then we are going to discuss diseases that are antimicrobial resistant. And finally, we are going to discuss steps that we can take to curb antimicrobial resistance. So why is this a problem? Well, there are a few reasons. For one, the economic costs that come with antimicrobial resistance are astounding. This picture to the side says that a failure to address the problems of antimicrobial resistance could result in 10 million deaths per year by 2050, and it could cost 100 trillion in economic output. According to WHO, the clinical pipeline of new antimicrobials is pretty dry. In 2019, WHO identified 32 antibiotics that addressed their list of priority pathogens. However, only 6 of these were innovative. The cost of this to national economies and health systems is significant because it affects the productivity of their patients or caretakers. And this is done by prolonged hospital stays and the need for more expensive and intensive care. Essentially, when you get sick with an infection, they give you an antibiotic. And if this antibiotic does what it's supposed to do, it kills off the microbes, and you are released from the hospital and able to return to your activities of daily life. However, if you have an antimicrobial resistant infection or virus or fungus, you could need more treatment, more intensive treatment that could keep you away from your job, from your families, for much longer than a normal infection. The success of treating these infections could be diminished. New antimicrobials are urgently needed. For example, E. coli, which is one of the causes of UTIs, if you aren't able to treat that E. coli bacterial infection with the mainstay antimicrobials, you're going to need something else. And that could be very difficult because that infection could then travel to your kidneys or to your blood, and a whole slew of very, very bad things could happen if you don't get the treatment that you need. Antibiotic shortages are also huge right now. Like I stated earlier, the pipeline of new antimicrobials is dry. We need more innovative antibiotics. We need more innovative treatment strategies to combat these antimicrobial resistant pathogens. How does antimicrobial resistance happen? Essentially, these genes, these bacteria, evolve. It's natural selection. They may develop new processes, and by that they may change or destroy the antimicrobial, and they may restrict access. So by restricting access, they change the entryways or limit the number of entryways within the pathogen. For example, a gram-negative bacteria has an outer layer that protects them from their environment. And this membrane can be used to selectively keep antibiotic drugs from entering. This information comes from the Centers for Disease Control and Prevention. They can get rid of the antibiotic by using pumps in their cell walls that remove antibiotic drugs from the cell. They can change or destroy the antibiotic with enzymes that break down the drug. They can bypass the effects by developing new cell processes that avoid using the antibiotic's target. Or they can change the targets for the antibiotic. Antibiotics are designed to single out and destroy specific parts of the bacteria, virus, fungus. These microbes then change their targets so the drug can no longer do its job. There is a little infographic over there about how these little guys can share their resistance. They can share through transduction, which is genes being transferred from one germ to another with phages. They pass this on through conjugation, or resistance genes being transferred between germs when they connect, or transformation, which is resistance being released from live or dead germs and being picked up by another germ. Horizontal gene transmission and mechanisms such as that. I apologize, I have a cat who's trying to climb on top of my laptop. Diseases that are microbial resistant. There are many that are becoming more and more resistant to antimicrobials. Today we're going to cover 3. We're going to cover methicillin-resistant Staphylococcus aureus, which is also known as MRSA, Clostridium difficile, C. diff, and vancomycin-resistant enterococci. So MRSA, methicillin-resistant Staphylococcus aureus, is one of the big ones. Working in a hospital myself, I see frequent MRSA screens for pre-op patients in the lab. So Staphylococcus aureus is commonly found on our skin and in the nose, and most of the time this is a pretty harmless bacteria. However, when they get inside a wound, they can cause severe infection. These usually begin as little benign small red bumps or abscesses or boils that need to be surgically opened and drained. Sometimes it stays on the skin, but it can invade body processes such as bones, joints, the heart, or even the lungs, and this is potentially life-threatening. It is one of the most common hospital-acquired infections. Clostridium difficile infects the colon. It usually happens following antibiotic treatment. So this again is something that is seen within hospital environments. The community of microbes that we normally have in our gut, our microbiota, usually prevent C. diff colonization. However, when we're treated with antibiotics, sometimes we don't just kill the microbes that we want to kill. Sometimes we kill our healthy gut microbiota. And that's when C. diff kind of weasels its way in and really gets its teeth in. Around 500,000 people are infected each year, and this results in approximately 15,000 deaths. C. diff is naturally resistant to many of our common antibiotics, and it causes inflammation in the colon, which can cause mild to severe diarrhea. Vancomycin-resistant enterococci. Enterococci are commonly found in the human gut as well as the female genital tract. Infections tend to occur in people who are hospitalized or susceptible to infection due to other medical problems. These individuals normally have catheters or other devices where these enterococci can get in and colonize. Healthcare providers normally use vancomycin to treat enterococcal infections. However, these VRE, vancomycin-resistant enterococci, do not respond to that treatment. Steps that we can take to curb antimicrobial resistance. Funding for more antimicrobial research and development. As stated in previous slides, there are not a lot of new antimicrobials being developed right now, and that part of that is because people don't want to be on antibiotics, so the funding there is not as stout as it needs to be. And finding new and innovative ways to treat infections is cost and time consuming. Instead of prescribing antimicrobials for unnecessary infections, we should really be focusing on curbing the prescription of antimicrobials. For example, COVID-19, a lot of individuals within a hospital in Italy were treated with antibiotics when none of them had an antibiotic or a secondary infection. This is just another reason why it's incredibly important to use these antibiotics the way they're meant to be treated. Another thing that we can do to curb antimicrobial resistance is to stop using antimicrobials in food-producing animals or in agriculture, or as self-medication. Another way is to educate on the proper use of antibiotics. That means actually using the antibiotics for the entire prescription, not just taking them until you feel better and then stopping. Because what that does is that allows these resistant few to become the resistant many. I found all of my information from the Centers of Disease Control and Prevention, the U.S. National Library of Medicine, NYU Langone Health, and the World Health Organization. Thank you very much for your time, and I hope you enjoy your day.